Oklahoma's emergency medical services are in crisis mode, and lawmakers are trying to figure out how to keep them viable. Oklahoma Horizon's Alyssa Hines reports.
When a medical emergency happens, you naturally expect help to be a phone call away. But according to Rodney Johnson, director of the Medic Institute, our state ambulance services are at unsafe levels.
The fact of the matter is this business model of the way we have been delivering emergency medical care no longer works and is on the verge of collapse. I call it the #1 public health threat that no one's ever heard about.
And in a time when the legislature is looking at cutting taxes, Rodney fears that could have deadly consequences.
When I started this process with Medic Institute 5 years ago, the floor leader of the House of Representatives told me that sometimes in the state legislature, things have to totally collapse before we do anything about it. Well, in the EMS business, that costs lives. So the state legislature needs to decide how many lives is it willing to sacrifice before they're willing to do something about this deplorable problem.
It's a problem that legislator Seneca Scott feels needs to be addressed.
Well, it's important on a lot of different levels. I think that in part with just the tightening of resources we've seen statewide, nationwide, internationally, there's an ongoing effort to make the most bang for our buck. For now, also, in addition to the expenses, is also the weighty matter of public safety and getting people, the proper medical care needed.
Now, according to Rebecca Smith with the Oklahoma Ambulance Association, a special district may be one way to address the issue.
522 districts are ambulance service districts. They can either be by county or by city, or they can be by school districts, and they're funded in part through ad valorem taxes or property taxes.
But funding is still an issue.
We need them to realize that there's no one fix. Nothing is going to solve the problems that we have in EMS, but if we all work together, we can all have a piece of the different things that may help, and removing the cap or eliminating the cap of 3 mills, which has not changed since 1977, would be a small part of how we can help EMS services across Oklahoma shore up and maintain their ability to respond to the people who need them. There are many solutions, which we're so grateful that they're having the interim study, because this is a start to finding those solutions. It takes all of us working together.
The fact of the matter is, it takes a certain amount of money to run an ambulance service. It takes a certain amount of money to be able to have a well-educated workforce that is able to respond in today's medical environment. So while it is a local issue, there's no two ways about it. This is a problem that the state has to put some money into. I believe my best estimate is $40 million. Is what it would cost in today's money to be able to fix a lot of the problems that are associated with emergency medical care now. Where's that $40 million going to come from?
A good question, and one these EMS supporters believe legislators need to focus on.